According to the National Institute of Neurological Disorders and Stroke 2023, this refers to trouble with speaking, understanding speech, or reading and writing as a result of brain damage to a specific responsible for language processing and understanding. So my answer is letter B, aphasia. So when we talk about aphasia, it is a communication disorder that affects a personal ability to use or comprehend language. It often results from damage to language centers of the brain, typically caused by stroke, brain injury, or neurological conditions. Individuals with aphasia may have difficulty of speaking, understanding spoken and written language, reading and writing also. So treating the condition that causes it, as well as speech and language therapy, the person with aphasia relearns and practices language skills and learns to use other ways to communicate. Family members often participate in the process, helping the person also to communicate. So number 2 is, he points out that a child cannot possibly learn a language through imitation alone because the language spoken around them is highly irregular. Adult speech is often broken up, even sometimes ungrammatical. So my answer is letter C, Chomsky. Noam Chomsky is a linguist, a philosopher, and cognitive scientist born in 1928. He is renowned for his work in linguistics, so particularly the development of the theory of generative grammar. Chomsky's influence ideas extend to political philosophy, where he is known for critiquing government and media. His contributions have had profound impact in various fields shaping discussions on language, so cognition and solid structures. His groundbreaking works includes the development of the theory of generative grammar, challenging behaviorist views on language acquisition. So Chomsky argued that a child's ability to learn a language goes beyond mere imitation. So he proposed the concept of universal grammar, suggesting that humans are innately well equipped with a biological predisposition for language learning, making it more just a process of copying what they hear. So number 3 is, this language disorder caused by damage to an area of the brain that happened to an individual who speaks 2 or more languages. So my answer is letter A, bilingual aphasia. The term bilingual aphasia used to describe a type of language impairment that occurs in individuals who are perceived proficient in 2 languages. The use of the term reflects the specific nature of language difficulties experienced by bilingual individuals following a brain injury or neurological condition. So a bilingual aphasia refers to a language impairment in someone who is proficient in more than one language. It's not normal, but it can occur due to brain injury or other factors. Seeking professional assessment and intervention is recommended. Well, there are also different types of bilingual aphasia: the parallel, selective, and the differential bilingualism. So the 4th one is, who can help aphasic patients to at least recover, if not totally healed, from the language demise? So my answer is letter B, speech therapists. Speech and language therapists provide life-changing treatment, support, and care for children and adults who have difficulties with communication, eating, drinking, and swallowing. You help people who, for physical or psychological reasons, have problems in speaking and communicating. So evaluate the undiagnosed speech, language, communication, and swallowing disorders. Treat speech, language, communication, and swallowing disorders. So provide training and education to family or caregivers and other professionals. Work collaboratively with professionals from many other disciplines. And the last one will be another term for Wernicke's aphasia. My answer is letter B, a receptive aphasia. So Wernicke's aphasia or a receptive aphasia is when someone is able to speak well and use long sentences, but what they say may not make sense. They may not know what they are saying is wrong. So they may get frustrated with people don't understand them also. So the features of Wernicke's aphasia are impaired with reading and writing, says many words that don't make sense, use wrong words. For instance, you might call a fork a glibble, string together a series of meaningless words that sound like a sentence but don't make sense. Expressive aphasia is when you know what you want to say, but you have trouble saying or writing your thoughts. While a receptive aphasia affects your ability to read and understand speech, you can hear what people say or see words on a page, but you have trouble making sense of what they mean. So, Wernicke's aphasia, also known as a receptive aphasia, a sensory aphasia, or posterior aphasia. It is a type of aphasia in which individuals have difficulty in understanding written and spoken language. Patients with Wernicke's aphasia demonstrate fluent speech, which is characterized by typical speech rate, intact syntactic abilities, and effortless speech output. Writing often reflects speech in that it tends to lack content or meaning. So, in most cases, motor deficits, hemiparesis do not occur in individuals with Wernicke's aphasia. So therefore, they may produce a large amount of speech without much meaning. Individuals with Wernicke's aphasia are typically unaware of their errors in speech and do not realize their speech may lack meaning. So they typically remain unaware of even their most profound language deficits.